Welcome, everyone. Thank you for joining us. Our webinar topic for today is why you should sell skincare in your practice and leveraging WebMD to attract new patients. Today, we have two amazing presenters. We have Dr. Leslie Baumann, MD, FAAD. She's a board-certified dermatologist, researcher, and author. She is Director of Division of Cosmetic Dermatology at the University of Miami from 1997 to 2006. Dr. Baumann's clinical trial research has been instrumental in the FDA approval of Botox, Dysport, Cabela, Voluma, Sculptra, Othera, and other aesthetic treatments. She's also authors twice monthly a column for the Miami Herald newspaper and Dermatology News. And our second presenter is actually Steve Breitbach, who brings over 25 years experience in healthcare and wellness to the WebMD brand. As a senior sales executive with WebMD, his mission is to promote content to care. So we are thrilled to have Stephen provide us with a presentation on WebMD news directives and how to create competitive advantage to your practice. The agenda for today, both of our presenters will share their information, probably take about 15 minutes or so. You will then have the option to submit your questions throughout our presentation. To send us a question, please use the chat box, type your question, and submit to organizers only. We're also recording this webinar, and we will be sending it out the link for those of you that cannot stay for the entire process, or those of you that like to watch this later. So without further ado, let's get started, and I will turn it over to Dr. Leslie Baumann.
Hi, everyone. Welcome to the webinar. And this is a webinar series that we've been doing, and sometimes our topics will be more on science, sometimes it'll be more on office management. Today, it's going to be about how to increase revenues and get more patients, and we're partnering with WebMD. So I'm going to talk to you about why you should retail skincare. No matter what kind of physician you are, I'm a big believer that doctors are the natural choice to prescribe skincare, and I'm going to tell you why that is today. Okay. So 84.5 million Americans saw a physician for a skin disease in 2013. This is the latest data we have from the American Academy of Dermatology. So that's 84.5 million people who have a question about their skin. And many skin diseases are preventable if the right skincare products are used. And here again is some data from the American Academy of Dermatology. And basically, here's a list of different kinds of skin diseases that you can improve in your patients by having them on the right skincare. A lot of dermatology problems are avoidable. And other dermatology problems can easily be controlled with the right skincare. And I wanted to show you this graph from the AAD that patients who are 65 and over, 46.5% of them have something called seborrheic dermatitis, which is similar to dandruff. You get it on the face, and they won't know how to treat that themselves. They would need your advice. So it's very possible that no matter what kind of physician you are, that you have patients that have these disorders that need the proper skincare, and they don't know who to go to. They may not have a dermatologist in their area. Especially in the middle of the country, there's an access problem to dermatologists. The wait can be 3 months to get in. Some dermatologists are seeing 90 to 120 patients a day. So it's my hope that all kinds of physicians and all kinds of medical providers can start helping their patients with skincare, because my goal is really to prevent skin cancer, and the only way that that can happen is if people use sunscreen every day, use the right sunscreen every day, and are motivated to make the right skincare choices. So you can help me do that by talking about skincare with your patients. Skincare plays a very important role in skin health. The right skincare can improve your skin health, and the wrong skincare will decrease your skin health. And why should physicians retail skincare? Well, I write a column in Dermatology News that is owned by WebMD. You can find the column online if you put in my name, Leslie Baumann. Cosmeceutical Critique is the name of the column. This article, I talk about all the different reasons you should sell skincare to protect your patients. And basically, you're protecting your patients from people who just want to make money off of them, who will make all kinds of claims about their products, and the scientific claims are often inaccurate, and it's often pseudoscience. So really the patients need their physicians to help them decipher all of this marketing hype. So we're going to talk a little bit about through the different reasons that physicians should retail skincare. And the first ones are physicians have ethical integrity. All of us, every physician I've ever met who decided to spend those years to go to medical school is very ethical and wants to help their patients. I mean, that's really one common characteristic that physicians have. We're concerned about the outcomes of our patients. We want to make them better. We're not here to sell them something and make money. We want to improve the outcomes of patients, and that's what differentiates us from some of the other skincare retailers out there. And in most cases, we're independent from brands. Now, some physicians have their own skincare line, but for the most part, we can make independent choices and be what I call brand agnostic, meaning we don't have any preference for a particular brand. It's the ingredients and the science and the products that interest us more. We also have scientific knowledge that others don't have with all of our years of training, and cosmeceutical science is very confusing now with all of the growth factors and stem cells, the defensins, the retinoids, all the different talk about interleukins and cytokines. You really need a scientific degree to be able to understand all of those things. So patients need somebody who understands the science to be able to give them recommendations. And we know the skin science. We also know the science of the conditions. We, of course, if we're a dermatologist, we understand acne and rosacea and contact dermatitis, but other physicians as well have a better understanding of just in general skin conditions than the lay public. And also underlying medical conditions such as heart disease and diabetes and how those play a role in skin health. Another reason physicians should retail skincare is we have a medical approach to the problem. So I like to think about skincare as a prescription medication and as part of the overall treatment plan. And you can combine skincare and cosmeceuticals with prescription medications. In fact, I believe you should many times. So a medical approach to skincare, you can combine the skincare, the cosmeceuticals with prescription medications, with procedures such as chemical peels and lasers and injectables like botulinum toxin. A physician can develop a treatment plan. For example, seeing your patient every month and maybe doing a chemical peel every month that accentuates or helps the skincare products work better. And also, we can track improvement because we're trained to follow outcomes and track improvement. We also have a passion for patient care. That's what put us in this position in the first place of being physicians. Our patients are vulnerable. They all want to look their best. They all want to have healthy skin. They want to believe in the science, and so people take advantage of them. And you can protect your patients by giving them the accurate information and help prevent them from wasting a lot of money on products that, first of all, are a waste of money, but also may not work or may actually harm the skin. And I've done a study where I surveyed all of my patients in 2004 when I was at the University of Miami to see if they wanted me to sell skincare or not. And 100% of my patients wanted me to sell skincare. And they said it was because they wanted guidance about the products. They wanted to make sure that they went home with the correct product. If you just tell them, buy a barrier repair moisturizer, they don't know what that means. It's hard for them to go and find it. Even if you give them a sample of something and they are supposed to go to the pharmacy and buy it, it's often difficult for them to find the exact one on the shelf. So the patients said in this survey that they wanted to be able to go home with the exact product because it would save them time and help make sure they didn't make a mistake. They want your expertise and they want your knowledge. Now, this is proven that patients want to buy from their physician because the physician dispensed skincare market, that means skincare sold in a physician's office, is the fastest growing segment of the skincare market. In fact, it's expected to grow by 10.3% by 2024. So because of this, many of the skincare lines are focusing more and more on the physician dispensed segment. So I wanted to reach out to doctors and make sure that they know that this is happening so that they can prepare themselves for the questions that patients will be giving them about skincare. So in order to have good skin health, there's really two main things that have to happen. The patient has to be prescribed the correct cosmeceuticals, and then they have to have consistent compliance. If they're not going to use the products, they're not going to work. So I'm going to talk about a system that I developed that I use in my office to help accomplish these two things. And just to give you a little background on me, I love skincare. I've researched it for many, many years. I've written several textbooks about skincare and a New York Times bestselling book about skincare. So I could talk about skincare all day long. I read all the journals. I love the science. But not everybody loves the science and has the time to do that. So the system that I created makes it accessible to all doctors to be able to have access to the same science and the same good recommendations without having to know anything. So I'm going to tell you how that works. The first step is you need to identify the barriers to skin health that the patient's skin has. And those are dehydration, inflammation, disordered pigmentation, which is when they make too much pigment and the skin doesn't have an even tone, and then aging, so different factors that might lead to aging, such as cigarette smoking and sun exposure and things like that. So you need to identify which of those 4 problems or barriers your patients have. So back in 2004, I developed and validated a questionnaire that would do this for me because my staff at the University of Miami would have to do this for me. And you take a quiz, and it divides you into 16 skin types based on the presence or absence of those skin barriers. So you can see there are 16 skin types. Number 10, the perfect 10, is actually the best. It doesn't have any barriers to skin health. And that is the goal, is to, with skincare, take care of these barriers so that we can change the skin type to the healthiest skin type. And that is the long-term goal, is to have patients have healthier skin. So this questionnaire has been validated in all ethnic groups, both genders, and in ages 13 and up. So each skin type has different skincare needs, and skincare should be targeted to the underlying barriers to skin health. So what happens is your patient takes a questionnaire, and then it defines and diagnoses the skin type, and then software generates a skincare regimen for that skin type. And you can choose what brands you want to sell in your practice. This is a brand agnostic approach to skincare. So each doctor will decide what brands they want to carry. They choose from a list of products that have been independently tested by myself, and those are the products that pop into these regimens. So you know that your patients are getting the correct cosmeceuticals for their skin type. So the first step, again, is diagnosing the skin type before you design a regimen. And then you need to think about each product in the regimen. It's very important that each product enhances the efficacy of the other products, because products can cause problems with each other and make chemical changes in each other. So whenever the regimens are designed, they need to be designed not just with the science of one product in mind, but the thoughts of what happens when you layer these products. So the software takes this into account whenever it generates the regimen. It takes into account the barriers to skin health, the patient's skin type, and what brand the doctor chose, and then what order those products are going to go in. And if you had to do this on your own, it's really hard because there's a lot of different things to know. You need to know the chemistry of the ingredients. You need to give your patients a do and don't list of what not to do. For example, don't use retinol in the morning because sunlight will inactivate it. You need to think about the reactions that the products have when they combine together. And there's just all kinds of science that you need to know. So I wanted my staff to be able to help me, and that is why I developed the software methodology that prepares the regimens and the patient instructions ahead of time for me. So basically, when the patient takes a questionnaire in the waiting room, it generates a regimen, and the software tells exactly what products, and my staff can tell the patients to use those products. And without my staff knowing anything at all about skincare or skincare science, I have the peace of mind of knowing that my patients are getting the right skincare recommendations. So now we've given the patient the right skincare recommendations, but the second piece of this is compliance. How are we going to get them to use them? And I have some data that is really going to surprise you. It surprised me when I first heard it. But did you know that 1 out of 3 prescriptions is never filled in the dermatology world? So this is one reason why people come in and say, my rosacea is not better, my acne isn't better, my psoriasis isn't better. Well, a lot of times they didn't buy the prescriptions. And there's lots of reasons for that. Maybe it's expensive, maybe they were lazy. There's all kinds of reasons. So by being able to retail what you can from your practice, you increase the odds that the patient is going to go home with the right thing. Now, in some cases, cosmeceuticals can take the place of prescription medications, such as acne with retinoids. Retinol, for example, works well for acne just like Retin-A does. Another surprising statistic is that 95% of patients underuse their medications. So here you have somebody who maybe they're supposed to use a medication twice a day and they're only using it once a day. So why is this? This is called adherence, and there's actually an entire book in the dermatology world called Dermatology Adherence that looks at this and tries to figure out what makes some people use their medications and other people not use their medications. And most studies show that compliance with topical therapy is affected by the patient-physician relationship, the treatment regimen being congruent with their lifestyle. So, for example, if they have to put a product on 5 times a day, it's not going to happen. And patient education about what they're supposed to do and why they're supposed to do it. Now, obviously, this can take some time in the rooms, and not everybody has time in the rooms. And because of this, we often have poor communication between the physician and the patient. The physician is very busy, may not have time to answer these questions. I have friends that hate it when a patient comes in with a long list of skincare questions. I happen to love it because this is my thing. But a lot of people don't like it. And so the way to deal with that is to have your staff be able to answer those questions for you. And that will help improve communication. Because poor compliance equals poor outcomes, and you need a solution for this. So I'm obviously a believer that your staff can help. Using the software, they can help you prescribe the correct cosmeceuticals and also cause consistent compliance. So we have an innovative customized skincare diagnostic system that was developed for physicians just like you. The patient takes a questionnaire on a mobile app. It diagnoses the skin type, and then the regimen is automatically generated. And this is kind of the thought process that the software goes through. If you start with number 1 up at the top, the software figures out the skin type. Then it figures out the products from a list of brands and products that the physician has chosen that they want to carry. And those products have to have special characteristics and ingredients they can and cannot have to be able to fit in the system. So those products, the software picks those products, orders them in the regimen according to the science of the products and what ingredients are in there. Then it can adjust for lifestyle. So let's say somebody goes to the gym in the morning, then they would want to put their products on after they work out instead of before. Then the software gives educational material to the patient to help them understand why they need to use the products. Let's say they have acne, there'll be an acne information sheet that's automatically generated that explains to them why to use the products and also how to use the products. Retinol is always a good example. Using it every night in the beginning will irritate the skin, so the instructions tell them to use it every 3rd night in the beginning. And then this ability to communicate with the patients through an app and motivate the patients to use their products. And then the patients come back in a month to get reevaluated. Their regimen is tweaked, and then they go again through the cycle. And the goal is to improve the skin type. And what we've done at my company, Skin Type Solutions, is we've looked at every contact point with the patient from the time they research you online, which is the number 1 here, all the way to calling the front desk, waiting in the waiting room, going into the exam room, interacting with the staff, checking out the cashier, refilling the products on the mobile app. And we've looked at each one of those touch points with the patients, and we have maximized the ability to engage the patient and communicate with the patient all through your staff. And also we've made it as easy as possible on the physician because we know how busy you are, as I'm a physician myself. So if you want to learn more about our software solution, you can follow me on LinkedIn. You can email me, Dr. B at skintypesolutions.com, or the best and fastest way is to text Manny. This is his cell phone number, and he's available to answer questions. I'm also going to, after the next speaker, I'm going to be available if you have any questions for me. So you understand that patients want to know about skincare and they're interested in skincare, but how do you get more patients to come to your office? Because once you get our system in place and you see how you can really help outcomes, improve patient skin health, but also make money at the same time, you're going to be interested in getting more patients to your office. And WebMD has a great solution. And Stephen Breitbach is going to tell us about how WebMD can help you get more patients.
Well, thank you. First of all, Dr. Baumann, thank you for that wonderful presentation. And I want to thank you as well for inviting me to participate in this webinar. And I want to welcome everybody here. My name is Stephen Breitbach. I'm a senior sales executive with WebMD, and I'm here to share with you some of the new directives that are happening at WebMD. I think you might find them interesting. Our goal here is to utilize WebMD's positioning online to help direct patients to your practice, help them find your practice. And I'm going to demonstrate for you how to do that. So I'm just going to share my screen with you. You should be able to see the WebMD logo. It's a recognizable logo. We receive about 100 million visits a month to WebMD for our content online. That's about 1 in 4 people in America will utilize the content on WebMD to educate themselves, to inform themselves on medical issues. And we are in the process of utilizing that positioning to help what we in a program what we call content to care. And what that means is WebMD is known for its content. And if you look here, you see the WebMD website. This is very familiar. The content is continually updated with timely medical information. There's top stories here. We're constantly producing content on a regular basis, so people are very they're used to coming here to learn about issues. But we also have an area here that let me see if I can find that.
Excuse me for a second.
Yeah.
Right now we're looking at your logo. If you can minimize it, then we can see the screen behind it.
Okay, I'm sorry. Thank you.
No worries, no worries.
Let me just finish. Get rid of that. How about this? Are you able to see the WebMD website here? Is this clear? Okay.
We're still seeing your logo.
You're seeing the logo. Okay, I don't have the logo up on my screen any longer. I've closed it. Let me just see. What about now? What are you seeing now?
Same thing.
Really?
Same thing. Make sure you hit the button that says share your screen. There we go. We're
okay.
Good, Steve.
Perfect. Thank you for everybody for your technical difficulties. I apologize. So what you're seeing is the WebMD homepage. And this is the page that most people are familiar with. Like I was saying before, we get about 1 in 4 Americans, 100 million unique visits to WebMD every month. And so I'm going to demonstrate for you how you can utilize that for your practice. The best way to do that is to go to Google and to just follow what most people do when they're educating themselves or seeking medical information. This is the source for Google for basically all information these days. So just to give you an example, let's say, since I'm speaking with a dermatology audience, I'd like to just demonstrate some basic searches that somebody might have for, let's say, skin infections. So I'm just going to type in skin infection in Google, and what you'll find is WebMD's at the top of the search results. Now that's out of 308 million search results. You'll always find WebMD at the top of those, at the top of that search, and that includes most medical terminology, whether it be textbook terminology or layman's terms. Just to give you another example, if I type in eczema, for example, again, you'll find WebMD at the top of that search. Now, what does that mean to your practice? Well, because of our positioning with this content, we've been publishing content for over 20 years. The general public recognizes WebMD as accredited, viable source for information. So they do come here. So when they click through this and they're reading our content, the next step would be to connect them with a provider, a medical provider. Now, what you may or may not be aware of, that we have a directory here on WebMD, an ability to search for a doctor within your area. So I'm just going to walk you through an example here. Let's say I'm going to use Atlanta as an example, Atlanta, Georgia. So if our potential patient is in Atlanta, or they're in your city, and they type in they're looking for the provider, and they may be looking for a dermatologist, what they'll find here is this medical directory. Now, this is what we offer all medical professionals, is what we call a basic profile, and within any geographical location, we can pull out a directory here. So in this case, within Atlanta, there's 340 dermatologists within 25 miles of the Atlanta metropolitan area, which creates this directory here. And that directory is pretty lengthy. It's got 34 pages. And so even though a provider may have a profile in this directory, it still has to be found by the public. So this is where we've created a new directive called the enhanced profile. Now, the enhanced profile is designed to capture the traffic that comes to WebMD. It's designed to have more functionality. For example, these two providers here if they've taken advantage of the enhanced profile program in Atlanta. So I'll just give you an example. I'll click on this and just show you what the enhanced profile entails. Now, it has a dedicated phone line that appears or the phone number that appears in the profile itself. There's a request an appointment function as well. A patient can click on that and basically fill out a form and submit that, and it will come across to your office as an email, and the receptionist or office manager who receives that can follow up and confirm that booking. If you have a calendar, an appointment calendar on your website, we can connect it to that as well. That tends to be a preference between providers, whether they prefer to have those, how they want to book those appointments. But it does have that function, and also it provides a link to your website. So with this functionality, the idea here is that these enhanced profiles are designed to capture the traffic and direct it to your practice. Now, the way we also do that is to use search engine optimization. And how we do that is in this area here within the profile. There's a section called conditions treated and procedures performed. Now, what that is search terms that people may be searching the web for that are pertinent to your practice. So for example, as I showed you earlier, if you pull out any of these and do a Google search on it, you will find, again, WebMD usually comes up at the top of that list. Now it's through that search engine optimization, being positioned here and at the top of Google, that your profile is now pulled from that search and into that Google search results. And over time, it pulls your profile and your website into that Google search within your area. Now, the direction we're taking with WebMD, we are this is a new directive for us, but what we're working to do is make that more of a seamless process. For example, that Google search that lands here on the content at WebMD, currently there's find a doctor link at the top. What we're working to do is create the content to care program, which is a more seamless process, meaning while the potential patient is reading the content, a pop-up comes up and asks them if they're interested in finding a doctor within that area. And if they click through that, it takes them to that local directory. And it's the profiles here, these enhanced profiles, that are designed to capture that traffic. Now, I'll just give you an example of how this works. So for instance, I mentioned Atlanta and we have 2 enhanced profiles within that directory. So if I go to, I can pull up some of the metrics here. You should be able to see this. This is behind the scenes here. This is the statistics that we show within the city of Atlanta. So I'm going to click Atlanta as the metropolitan area. We show 413 providers in dermatology. Out of that, there was 4,436 unique visits to WebMD to this directory. And when I click here, I can see the distribution of that traffic. So based on the NPI number of the provider, I can rank them based on the amount of traffic that was received, that their profile received in our directory. And if you look at these top ones, they're in the triple digits here. I did some research prior to this to make sure that I had the right NPI numbers. And the two profiles that you see in the directory at the top received within the top 4. They ranked in the top 4 providers for traffic on their directory. If I go back here, let me just show you this. The top one received 143 unique visits in the month of July. Number 2 was 126, and that's a doctor that has the enhanced profile. The other enhanced profile is ranked number 5 at 96 unique visits within the month of July. So the idea here is with that increase in visits to the profile and the functionality that directs it towards your practice through that claim, through the request an appointment or the link to the website or the dedicated phone line, we're able to track exactly how much traffic is being generated from this profile to your practice, and that generally translates into new patients. And that's the idea here, is that we want to utilize the traffic of WebMD, the popularity of WebMD for the content, and be able to capture that and direct it to your practice through the enhanced profile program. It's very effective. It works really well. And if you have any further questions about it, I'd urge you to get in contact with me. I'd be happy to work with you to show you how we can take a look at your basic profile and then work with you to enhance it to help build your practice and to drive traffic, online traffic to your practice. And with that, does anybody have any questions?
Thank you, Steve. We appreciate it. Yes, we do actually have several questions that already came in.
Okay.
So I want to make sure that we have enough time to go over them as well. So the first question, Dr. Baumann, actually this question is directed to you.
Okay.
And this question is coming from Alonso from Texas, and he's asking, does the system work with any skincare brand?
Alonzo, thanks for your question. Does the system work with any skincare brand? It works with almost every skincare brand. We've looked at over 40 of them. Of course, if there's a new brand that I haven't had time to research, it wouldn't be included in the system. But what happens is I go through the products and I make sure that each product has the ingredients that it needs to have and doesn't have the ingredients that it can't have to meet the criteria for the position that it falls into the regimen. So we have most brands that have been already tested. Now, products that aren't good and don't have the right ingredients or make false claims are not included in the system. So to be an STS-approved brand, there are certain criteria you have to meet. So there are a lot of brands, but not every brand is included.
Okay, great. So we do have more questions here. They're coming kind of fast. So Stephen, I'll ask you this one. Tim from Florida is asking, how do you get your office listed in the directory when patients go to WebMD? Stephen, can you hear us? Okay, we'll figure that out.
Maybe he got disconnected.
Okay. Okay, Dr. Baumann, we do have other questions for you. We have Roger for North Carolina. He's asking, how many doctors are using the software at the moment?
It changes every day as more come on board, but the last time I checked, we had 175 doctors who had signed up to use the system, and it's 30 states across the country.
Okay, great. We also have a question from Kevin from Georgia. It's asking for you, Dr. Baumann, when should I schedule the follow-up visit to reevaluate a patient?
Kevin, that is such a great question. There's actually a Dr. Feldman at Wake Forest who's researched this and looked at compliance from all different kinds of angles. And just like with working out and going to a nutritionist, usually the first 3 days before you see the doctor and the first 3 days after the doctor, you're the most compliant, but it tends to drop off after that. So we recommend having some sort of contact with the patient within 3 days and then having a follow-up visit at 4 weeks, because 4 weeks tends to be the time when people quit exercising or quit using their skincare products. And so I call that the cheerleading visit. So every 4 weeks is when you need to see the patients.
Okay, that's great. We have a question also from Nancy coming from Michigan. Says, once I decide to use the software, what is the process of getting started? And there's a follow-up question that she also typed and says, and how long does it take?
So Nancy, we usually can get you up and running in about 4 weeks. So the first thing that happens is you work with a shelf designer to design the shelves for the waiting room, and you pick the brands that you want to sell in your practice. Then the staff is trained on how to do the software so that it's not difficult for the physician. The staff is going to be the one who's doing all of it. And also we track how many quizzes are given at the front desk, for example, and how many regimens are generated in the exam room. So, and how many times the cashier has sold products, so we can tell you if it's not working, what position in the practice is causing the problem. So we need to train you on all of that, and that usually takes about 4 to 6 weeks.
Okay. And the follow-up question we have from Stephanie coming from California. She's asking, I find it difficult to keep my staff up to date. What type of training do you offer, especially for my staff?
So Stephanie, I was at the University of Miami for 13 years, and I love teaching and doing webinars. So one of the reasons I did this company was so that I could teach and share my skincare knowledge with people. So we have baseline training for the staff to get them up to speed, and then we have continuing education. We usually do it in the form of webinars, but we also have an Instagram account, Skin Type Solutions, and my LinkedIn account, Leslie Baumann, MD. We're constantly keeping people up to date on all kinds of things. So we also have interactive online courses for the staff. So we have all different levels of staff training depending on what position they are in your office.
Okay. Stephen, are you back by any chance? We do have a couple of questions for you. Okay. All right, Dr. Baumann, we do have another question. This question is coming from Patty from Florida, and she's asking, how long does the questionnaire usually take to complete?
It takes about 3 to 5 minutes, and it's done in the waiting room. And it goes along with our idea that the education of the patient should begin while they're in the waiting room. So not only does the questionnaire diagnose the skin type, but it also starts to educate the patients and make them start thinking about their habits and what they're doing to their skin. So the answer is 3 to 5 minutes.
Okay, that's good to hear. So we do have a couple of questions for those of you that submitted a question. It looks like Stephen's having some difficulty. So what I'll do is I will definitely send them those questions via email. And if you also need more information about us, you can also obviously type our info at skintypesolutions.com, and we will be more than happy to answer your question. Stephen, are you back?
I believe so. Can you hear me?
We can hear you now. Fantastic. So okay. I do have a couple of questions. Let me just, here's one that I found. I'm just scrolling through them as they're coming in. We have Tim from Florida. He was the first one that asked. He says, how do you get your office listed in the directory when a patient goes to WebMD?
Okay, the answer to that question is twofold. One, there's a basic profile that every doctor, every physician should have. If you go to WebMD directory, type in your zip code and your name, you should find your basic profile. If there's inaccuracies in there, you can contact us. You can claim your profile, contact us. We can make sure that it's up to date. Now, that's the basic profile. The enhanced profile is just that. It's an enhanced program. It's a subscription service that you work with WebMD. We build out that enhanced profile and we position it at the top of that directory in your area. So it is a subscription-based program, and it's just by reaching out to us, we'd be able to set that up for you.
Okay, that's great. Final another question for you. We have Oliver from Oklahoma. He's asking, is the listing based on the zip code of the patient searching? And what's the recommended distance between a patient and my practice?
The search is based on the geolocation of the person. For instance, based on their zip code or their location, when they're doing a search in the WebMD directory, it's going to pull up based on their location the list of providers in that geographic location. Is generally it's defaulted to 25-mile radius. The user does have control to expand that or to contract that up to 75 miles down to 5 miles of their location.
Okay, good to know. Dr. Baumann, we do have another question. We have a question from FAAD, and he's coming from Texas, and he's asking, in regards to the training that you provide that you mentioned, is that live training or is that online? And can you talk a little bit more about the training that we provide?
Well, we provide live training. We recommend, if possible, that you send your staff here and do a live training because we really can get your staff motivated the most that way. Now, that's not always feasible. So if that can't happen, we can do it via webinar. We can do it live or we can do pre-recorded. And then we also have modules on a learning management system. That's kind of where that's like an online course situation where they log in and they do different modules. So we have many different training options.
Okay, and follow-up question asking in regards to once somebody takes the quiz and the questionnaire, when should that patient take it again? Let's say that you're seeing some improvement. Do they take it after every visit? How often should they take that quiz?
When the skincare regimen quits working. So the patient should come back and see the doctor in 4 weeks, and the doctor will evaluate the patient's skin. If they feel like the barriers to skin health have gotten better or something has changed, they can retake the quiz, or the doctor can just adjust the regimen right there. But the patients for sure need to take the quiz if they go through a big geographic change, like, for example, moving from Miami to Colorado where the weather's different, or they go through a pregnancy and their hormones change, or they go through menopause, or maybe they have a more stressful environment and all of a sudden they're having acne. So if their skin situation changes, they would retake the quiz as well.
Okay, great information. Stephen, for you, we have Jenny from Flores asking, is the annual fee or monthly fee, and how much does it cost?
It's generally an annual fee or a monthly fee. You do receive a discount if you pay annually. That being said, the cost is based on it's a tiered pricing structure based on the area of practice. Practices such as plastic surgery are in tier 1. There's a multi-tiered pricing for other areas of practice. Now, based on your area of practice, if you're interested in the program, if you reach out to me directly, I can give you the quote on that. And if you just mention that you were part of this webinar, I can certainly work with you on that pricing and give you discounted pricing as well.
Okay, fantastic. We also have Tom from Ohio is asking, does the person see the same listing if they're searching on their phone or mobile device, or do they need to go to a laptop?
No, it's crosses over platforms. So it not only does it appear in a desktop browser, but it will also appear in a mobile browser as well. So it does cross over. So there's plenty of reach as far as that goes. It covers basically all mobile devices, desktops, and the pads,
Okay.
the iPads.
All right. So it doesn't matter, like to your point, that how they're searching the information, they'll see it from any device.
Correct.
Stephen, another
Exactly.
question for you. Lisa from California is asking, I'm a general practitioner. How will a patient find my office since we're not specialized?
The physicians generally fall into the categories based on their specialty. There is a category for general practitioners as well as family physicians. So there you are found. It's searched by the area of practice. So all areas are designated in different categories, but the general practitioner certainly has a category of their own.
Okay, fantastic. So now I'd like to turn it over to Dr. Baumann. Anything else that you would like to add to the webinar? Any last thoughts for the audience?
No, but I want to thank Steve. WebMD has been a great partner with Dermatology News, and I look forward to doing more educational webinars with you. I think what you guys have developed is great, and I certainly am going to be one of the people who signs up for it. So thank you so much for your time.
Thank you for inviting me. I appreciate it.
Well, thank you so much, everyone. Thank you for attending, and we will be sending out this link for everyone that participated. And thank you once again for joining us, and we look forward to seeing you in our